We want to thank so much Liberia, thank the Minister for receiving us in this place, thank all authorities from Liberia, President, Government, Parliament, and thanks so much delegation of Liberian at the ECOWAS Parliament for the very, very good hospitality since we come to Liberia. We have mission here. We was in Guinea-Conakry, Sierra Leone, and now Liberia to sensitize and promote programs.
Cancer, because some of those substances are carcinogenic.
Yes.
So you also get cancer, so that has dangerous with drugs. Yeah, so we are actually working collaboratively, and the ministry and itself, we are building a neuropsychiatric hospital in Bensenville so that we can be able to institutionalize and treat our patients.
Complex. That's why when the president took over, he immediately set up a task force, a multi-sectoral task force on drugs and substance abuse. It's headed by the Minister of Health. But it has youth exposed, it has justice, LDA, gender, and everything.
How we are here. We want first of all thank the Minister of Education of Liberia and thank all authorities from Liberia for the very good hospitality.
You know, we saw a problem, we came together and put a plan together to address it, and then the results of it now can probably spread throughout the continent. We know this is not an issue unique to our region. It's a global issue, but I think we are rightfully situated with our traditions and culture to also help us address that. And most of what one, you know, being a mental health counselor, most of what drives people into this is economic reasons.
On this matter, and I said, we just need to have a conversation around it and understand the perspective from which the cause is coming from. And I think I still do have a lot more questions.
We can't overemphasize the urgency with which we need to handle the drug issue. It's now or never, because if we have a population that is 60-65% with young people and a median age about 19, and this is right there, and we depend on them. One of our key assets that we have in Africa when we talk about Africa in the future is our youthful workforce. And if we sit down and let this drug problem, you know, runs through this youthful workforce, then what is the human capital that we depend on for Africa, you know, to move forward in the coming years? So obviously, you know, your efforts are in the right direction.
Well, you know, our region, the issue of drugs is a major issue in our West African region. So the ECOWAS Parliament, during our last session, adopted its work program for 2026 to do a tour of the ECOWAS region to understand the different approaches with governments and civil society, the fight against drugs and substance abuse. So the ECOWAS Parliament in June visited Guinea-Conakry, where they conducted a similar tour and study. In July, they were in Sierra Leone. They did similar down there in Liberia. The idea of this mission is that we want to synchronize a drug law for West Africa. When this mission is completed, they're going to do a presentation to the ECOWAS Parliament in our next session, which will be held in Ghana. And the result from that will go to the authorities of head of states and government, that is all of the presidents. And then we'll see how best we can adopt a common front in the fight against drugs. The issue of drugs is very, very important in our region. It's affecting our young people, and it's taking all our generation. And we feel that if nothing holistic is done about it, we're going to have a major crisis in the not too distant future.